Welcome to the deep dive. We've got a fascinating piece of research in front of us today.
Yes, it's an academic review called The Role of Vitamins, Nutrients, and Probiotics in Rosacea, a comprehensive review. Quite a mouthful.
It is. And our job really is to dig into this, pull like the key insights, the practical stuff, how these vitamins, nutrients, probiotics might actually connect to rosacea.
Exactly. And rosacea, well, it's this chronic inflammatory thing, mainly hits the face. Affects a surprising number of people, too. The review says around 5.5% globally.
Wow, that's significant. And it really impacts people's lives, doesn't it? It's not just cosmetic.
Not at all. Quality of life is a big factor, and it shows up so differently in different people.
Right, which leads to how it's classified. I gather the old way, the subtypes,
Yeah.
isn't really how doctors look at it now?
Yeah, that changed back in 2017. The National Rosacea Society went for a phenotype-based system. So less about fixed boxes, more about, well, individual features.
Phenotypes, meaning the observable characteristics.
Precisely. They look for core signs first, like that persistent redness in the middle of the face, or maybe skin thickening, phymatous changes.
Okay.
And then they look at major features like bumps and pustules, flushing, those little visible blood vessels, telangiectasia, or even eye problems.
So it really highlights how unique each case can be.
Exactly. Which makes sense because the causes aren't simple either. The review calls it multifactorial.
Meaning lots of different things contribute.
Yep. Your immune system might be off-kilter, blood vessels acting up, nerve signals. Even the microbiome, the bacteria on your skin and in your gut, seems to play a part.
Microbiome. That's a hot topic.
It really is. Plus genetics, environmental triggers, of course. And something getting a lot more attention now is oxidative stress.
Oxidative stress, like an imbalance. Too many damaging molecules.
That's the idea. An overload of reactive oxygen species, or ROS, and the body's defenses can't keep up. Seems increasingly implicated in rosacea.
Okay, so people often use standard treatments, creams, pills, maybe laser.
Right, the conventional stuff. Topical and oral meds, physical treatments.
But the review notes these don't always get things fully under control for everyone.
That's a key point. Many patients still struggle, which is why there's growing interest in complementary approaches. Things like nutrition, probiotics.
Which brings us to the gut-skin axis.
Ah, yes, the gut-skin axis. Sounds complex, but the basic idea is straightforward.
A connection between your digestion and your skin.
Essentially, yeah. A two-way street. What happens in your gut, especially with the microbiota there, can influence your skin and maybe vice versa, too.
Interesting.
And this review suggests this interaction is pretty relevant for inflammatory skin conditions, rosacea included.
So this review basically scanned all the science out there on vitamins, nutrients, probiotics, and how they link to rosacea, causing it, managing it.
Pretty much. They did a systematic search, PubMed, Scopus, Web of Science, the big databases, looking for studies connecting these elements to rosacea, whether in people or lab models.
And they rated the evidence quality, right? Because not all studies are equal.
They did. They used categories like high, moderate, lows. Based on study design, randomized controlled trials are usually stronger sample size, consistency across studies, that kind of thing.
So high means pretty solid evidence. Low might be just case reports or small studies.
You got it. It helps weigh how confident we can be about each finding.
Okay, good framework. Let's dive into the specifics then, starting with vitamins. Vitamin A, common in skincare. What's the verdict for rosacea?
Well, the evidence for vitamin A derivatives retinoids is actually rated high. Pretty strong.
High, okay. So what are they doing?
Topical ones like adapalene gel seem pretty good at reducing the inflammatory bumps and redness. They work by helping normalize how skin cells shed.
Normalizing shedding.
Yeah, follicular keratinization, plus reducing inflammation and kind of modulating the skin's immune response.
So tackling it from a few angles. I've heard retinoids can be irritating at first, though.
They can be, yeah. The review mentions potential initial irritation, but usually if you introduce them slowly, carefully, they're tolerated quite well.
And there's specific support for the type with bumps and pustules.
Yes, a systematic review backs them up for papulopustular rosacea, especially if there are issues with that skin cell buildup, the keratinization disorders.
What about tougher cases? Does vitamin A help there?
It seems so. For severe, stubborn rosacea, low-dose oral isotretinoin, another retinoid, shows good results. A study found high clearance rates and, importantly, low relapse rates.
That's encouraging for people really struggling. So vitamin A, quite a key player then. Normalizing skin, reducing sebum, inflammation, immune effects. Okay, what about B vitamins?
Evidence here is more moderate overall, but niacinamide, that's vitamin B3, really stands out.
Niacinamide, right. I see that in products.
Yeah, topical forms, maybe 4 or 5%, seem to help reduce redness and actually improve the skin's barrier function.
Barrier function. That sounds crucial for sensitive, inflamed skin.
It really is. One study showed a niacinamide moisturizer improved the barrier and hydration significantly compared to just a basic one. It helps strengthen that natural defense.
How does it work exactly?
Multiple ways, it seems. It's anti-inflammatory, so it calms things down. It boosts that barrier function we mentioned. It helps reduce those damaging ROS molecules.
The oxidative stress one.
Exactly. And it might even influence oil glands a bit.
Interesting. Any word on other B vitamins like B12?
Not much direct evidence for rosacea specifically. There was one small report mentioning B12 for inflammatory skin issues generally, but nothing concrete for rosacea itself. So niacinamide seems the main B vitamin of interest here.
Got it. Okay. Vitamin C, another popular one. Antioxidant powerhouse, right?
Definitely. Evidence quality is moderate here. As an antioxidant, it tackles those free radicals, which, as we said, seem elevated in rosacea.
So helping fight that internal stress.
Pretty much. One study showed some improvement with a 5% topical C preparation. It's thought to neutralize free radicals, maybe strengthen capillary walls.
Which could help with the redness and visible vessels.
Potentially, yeah. Plus it has anti-inflammatory effects, maybe a mild brightening effect too.
And it often gets combined with other antioxidants.
Very often. Especially vitamin E and ferulic acid. That combo seems to boost sun protection and antioxidant effects even more.
Which is great for rosacea, folks, since sun is often a trigger.
Exactly. That enhanced photoprotection could be really valuable.
Makes sense. Okay, how about vitamin D? Lots of talk about D deficiency these days.
There is. Evidence here is moderate again. Some studies have definitely linked low vitamin D levels with more severe rosacea.
Really? Lower D, worse rosacea.
Seems that way. One study found lower levels in patients versus controls and an inverse correlation with severity. The lower the D, the worse the rosacea seemed to be.
So does boosting vitamin D help then?
Well, possibly if someone is deficient. Vitamin D does influence the immune system, affects antimicrobial peptides like cathelicidin, which are often out of whack in rosacea, and plays a role in skin barrier.
So it has relevant mechanisms?
It does, but the review is careful here. While fixing a deficiency makes sense, there isn't enough evidence yet to say everyone with rosacea should supplement with vitamin D. It's not a universal recommendation based on current data.
Right. Important distinction. Not a blanket fix, more about correcting deficiency if it exists. Okay, vitamin E.
Evidence for E is low to moderate. It's another antioxidant, fat-soluble. Often pops up in formulations with C.
Protects against that oxidative stress again.
Yes. And one study showed topical vitamin E acetate helped reduce UV-induced inflammation. Again, relevant for sun sensitivity. It also seems to boost sunscreen effectiveness.
So antioxidant, bit of moisturizing, anti-inflammatory, works well with others like vitamin C.
That sums it up pretty well.
Lastly, for vitamins, vitamin K. Don't hear much about that one for skin.
Yeah, evidence is low for rosacea. The theory is it might help strengthen capillary walls, maybe reduce the look of those visible vessels.
Any evidence at all?
There was a small study showing it helped with bruising after procedures, suggesting some effect on vascular stability. So theoretically, it could help with telangiectasias.
But it's a leap to say it helps rosacea based on that.
Exactly. We need specific rosacea research. You might see it in some products, but the strong science isn't really there yet.
Okay, that covers the vitamins. Let's shift to other nutrients. Antioxidants generally, and oxidative stress, you said this is getting more focus.
Absolutely. Evidence is moderate to high here. That 2024 study developing the DAQI, the Dietary Antioxidant Quality Index, is really telling.
DAQI, what did that involve?
It looked at 12 dietary components, total antioxidant capacity, specific things like polyphenols, phytosterols, vitamin C and E, beta-carotene, minerals like zinc, selenium, a whole panel.
And what was the big finding?
People eating diets scoring higher on this index, basically, more antioxidant-rich foods had significantly lower odds of rosacea having a major negative impact on their quality of life.
Wow. So diet really made a difference in how much it bothered them.
Yes, and they also reported fewer symptoms compared to those with the lowest antioxidant intake. It really points towards a combined approach antioxidant skincare and an antioxidant-rich diet.
That's a strong message. So more fruits, veg, tea.
Exactly. The review mentions those, plus carotenoids, minerals like zinc, selenium, copper, found in lots of plant-based foods.
Let's zoom in on zinc then. Mentioned it briefly, but as a nutrient.
Right. Moderate evidence, again, zinc's vital for the immune system. It's an antioxidant, anti-inflammatory.
Hmm.
But oral zinc trials for rosacea have been a bit inconsistent.
How so?
One study showed oral zinc sulfate significantly cut down bumps and pustules, and the effect lasted even after stopping. But another trial found, well, no real benefit over a placebo.
Why the difference?
The review speculates it might be down to baseline zinc levels, which often weren't measured. If you already have enough zinc, maybe taking extra doesn't do much.
That makes sense. What about topical zinc?
There was one study looking at topical zinc sulfate solution, and it found it worked better than a tea lotion for reducing rosacea severity. So maybe topical use is more consistent.
And the potential mechanisms are anti-inflammatory, antioxidant, maybe antimicrobial too.
Yes, and modulating immunity. Those seem to be the main pathways.
Okay. Omega-3 fatty acids, always hear about those for inflammation?
Yeah, well-known anti-inflammatories. Evidence for rosacea specifically is low to moderate, though.
So, promising, but not nailed down for rosacea yet.
Kind of. We know they help in other inflammatory skin conditions from a systematic review, but that review lacked many rosacea-specific studies. The potential's there, based on how they work.
Which is how?
They reduce pro-inflammatory signals, help resolve inflammation actively, and influence immune cells. The review suggests focusing on dietary sources first.
Like fatty fish, flax seeds, chia seeds, walnuts.
Exactly. Get them from food if you can.
Right. Polyphenols next. Plant compounds.
Yes, moderate evidence here, known for strong antioxidant effects. Think grapeseed extract, resveratrol.
Resveratrol. Yeah.
One study found a topical mix of resveratrol, green tea polyphenols, and caffeine helped reduce facial redness.
Interesting combo, green tea specifically.
Yeah, green tea polyphenols like EDCG have shown promise in lab studies. They might inhibit angiogenesis, new blood vessel growth, and VEGF, a protein involved in that.
So that could target the vascular side of rosacea.
Potentially, yes. And polyphenols are everywhere. Berries, grapes, veggies, tea, coffee, even dark chocolate, nuts, whole grains.
Good to know. Selenium, another mineral.
Yep, low to moderate evidence. Essential trace mineral works with vitamin E as an antioxidant. Protects skin from oxidative stress, especially with E.
But again, limited rosacea-specific research.
Pretty much. Potential mechanisms involve antioxidant defense, UV protection, inflammation modulation. Mainly theoretical for rosacea right now.
Okay. Now, azelaic acid. That's a standard topical treatment, isn't it?
It absolutely is. High evidence quality for its treatment role. The review notes it's actually naturally found in grains, which is interesting.
But its main impact is as a medication you put on the skin.
Definitely. Studies clearly show topical azelaic acid, like a 15% foam or gel, is effective more so than placebo, and even shown to be better than metronidazole gel for reducing lesions in one study.
So natural origins, but clinically used as a topical. Got it. What about general diet then? Triggers and helpful foods.
Yeah, moderate evidence suggesting diet is pretty influential. Many patients report specific food triggers. A survey highlighted common ones: alcohol, especially red wine,
Heard that one.
spicy foods, hot drinks, dairy for some,
Other potential triggers.
chocolate, coffee, citrus fruits, refined sugar are also on the list for some people. It's very individual, though.
So keeping a food diary might help pin down personal triggers.
Could be very useful, yeah. And on the flip side, foods that might help are generally those anti-inflammatory, antioxidant-rich ones.
Like veggies, nuts, whole grains, tea, fish for the omega-3s.
Exactly. And remember that DAQI study reinforces the idea that a generally antioxidant-rich diet seems beneficial overall. Dietary changes are definitely part of a good management plan.
Makes sense. It's about finding your triggers and boosting the good stuff. Okay, let's move to probiotics and that gut-skin axis. Seems like a big area now.
It really is. Moderate to high evidence quality linking the gut-skin axis to rosacea. It's that two-way talk between gut microbes and skin health.
And imbalances in either gut or skin bacteria might contribute to rosacea.
It's the growing idea. It's maybe less explored in rosacea than in, say, eczema, but the evidence is building. Dysbiosis, that imbalance, seems relevant.
How could gut problems actually affect facial skin?
Several ways proposed. Inflammation starting in the gut could become systemic. Gut microbes produce different substances, metabolites that circulate. Immune responses can be modulated from the gut. Even nerve signaling and gut permeability, leaky gut, might play roles.
Wow, complex connections. So what about taking probiotics orally? Does that help?
Moderate evidence suggests it might. Some promising trials. One added a specific E. coli Nissl strain to standard treatment.
E. coli. Isn't that usually bad?
Yeah, most strains are, but this Nissl 1917 is a specific probiotic strain. Anyway, adding it led to better recovery, more beneficial gut bacteria like lactobacillus and bifidobacterium, and improved quality of life.
So it boosted the standard treatment.
Seemed to, yes. Another trial used a bifidobacterium strain plus another agent and saw higher remission rates and, again, increases in those good gut bacteria.
Any other examples?
There was a case report, just one person, mind you, with scalp rosacea. They did well on antibiotics plus a probiotic mix, Bifidobacterium boerevii and Lactobacillus salivarius. Crucially, they didn't relapse after stopping the antibiotic, just staying on the probiotic.
Interesting. Suggests probiotics might help maintain remission.
Possibly, it points towards specific strains potentially being a useful add-on. What about putting probiotics on the skin? Topical use.
Evidence there is low to moderate. The idea is to directly help the skin barrier. Fewer big trials, though.
But some research exists.
Yeah. One trial used a product with thermal water, Vitreosilla filiformis, probiotic bits, hyaluronic acid, niacinamide, vitamin E. Quite a mix.
Yeah.
And what happened?
It seemed to improve hydration, reduce water loss, lower dermatitis mite density. Those are often linked to rosacea, improved redness, and people felt better about their skin.
So, some positive signs. Other promising topical strains mentioned.
A few others like Lactobacillus paracasi, L. ureteri, L. plantarum have shown potential in lab studies or other contexts for improving skin barrier function. Still early days for topicals, though.
Okay. So, summarizing the ways probiotics might work for rosacea.
Right. The review points to a few key mechanisms. 1, restoring gut bacteria balance, fighting that dysbiosis. 2, improving skin barrier function. 3, anti-inflammatory effects, modulating the immune system. 4, maybe reducing Demodex mites.
And I.
5, modulating that whole gut-skin axis, improving gut barrier integrity, lowering systemic inflammation, influencing those circulating metabolites.
It really paints a picture of the systemic condition, not just skin deep. So, pulling it all together, vitamins, nutrients, probiotics, what's the overall management strategy suggested?
It really screams multifaceted approach. You need several angles. Conventional treatments are still the foundation.
And prescription creams and pills.
Exactly. Metronidazole, azelaic acid, ivermectin topically, oral antibiotics or isotretinoin, tailored to the person's main symptoms and severity.
But that's not the whole story.
Not at all. Cosmetic therapy, meaning good skincare, is vital. Gentle cleansers, good moisturizers, always broad-spectrum sunscreen, maybe specialized cosmeceuticals with helpful ingredients, and avoiding irritants, of course.
And then add in the nutritional side we've discussed.
Precisely. Aim for that antioxidant-rich diet. Consider specific supplements like C, niacinamide, zinc if needed, maybe based on testing or clear deficiency signs. Probiotics, focusing on strains with some evidence. Omega-3s from diet or perhaps supplements. And critically, identifying and avoiding personal dietary triggers.
Lifestyle plays a part too, right?
Huge part. Avoiding known triggers. Heat, sun, stress. Managing stress is key. Getting enough sleep. Moderate exercise, but avoiding getting overheated. Watching alcohol intake if it's a trigger.
And understanding the condition itself.
Absolutely crucial. Patient education, knowing it's chronic, sticking to treatments, recognizing triggers, having realistic expectations, and being aware it can affect you emotionally too.
It sounds like a truly holistic plan is needed. But the review also mentioned research gaps, didn't it? What are the main limitations now?
Yeah, quite a few. Many studies are small. Methodological weaknesses like no control groups or people knowing what treatment they got. Different studies measure success differently, making comparison. Lack of long-term data. No standard doses or protocols for supplements. Studies often don't consider individual variations in baseline nutrient levels or microbiomes, and not enough research on combining these approaches effectively.
So lots of room for improvement in the research. What's needed going forward?
Bigger, better designed trials, randomized, controlled, blinded. Studies looking at long-term effects. Research specifically on combination therapies. Personalized approaches tailoring things based on someone's specific microbiome or nutrient status.
That sounds like the future.
Hopefully. We also need standard protocols, studies that actually measure nutrient levels, more work on how these things work at a molecular level, and looking at cost effectiveness too.
Okay, this has been incredibly thorough. So, to quickly recap, vitamins, nutrients, probiotics, they definitely seem relevant to rosacea, both its development and management.
Yeah. Antioxidants are a big theme. Specific vitamins like A, B3, niacinamide, C show promise. Nutrients like zinc, omega-3s, polyphenols have potential. Azelaic acid is proven topically, and diet matters, triggers, and beneficial foods.
And that gut-skin axis and the role of probiotics, both oral and maybe topical, is a really exciting area.
Absolutely. The big takeaway is that a comprehensive plan mixing the best of conventional medicine with smart nutritional choices, skincare, and lifestyle adjustments likely gives the best results.
But, and it's an important but, more high-quality research is definitely needed to fine-tune everything and really personalize care.
Exactly. The evidence is encouraging, often compelling, but we need more definitive answers to create optimal, individualized strategies. Our understanding is constantly growing.
So perhaps a final thought for our listeners, given this really intricate link we've discussed between what's happening inside, in your gut, and what shows up on your skin. But what's one small change, maybe dietary, maybe lifestyle, that you might consider exploring, just to see if it shifts things for your own rosacea journey?
Or looking ahead, with all this focus on the microbiome, how different might rosacea management look in the future if we could truly personalize probiotic or prebiotic approaches based on an individual's unique gut and skin profile? Definitely food for thought.
It certainly is something to mull over and maybe bring up with your doctor or dermatologist for a more tailored plan. Thanks for joining us for this deep dive.